So I think that it was a really good complement for those type of patients. Now, I have a three-pronged kind of approach to my tinnitus management program. One of them is sound therapy, either through a customized individual, programmable device, or some other type of sound producing device, whether it's an app or something like that. But
Or like
most often
an
it's an
earpod or
ear
something,
level. I'm sorry?
like through an earpod or something, or
Correct. But I will say that most often it is an ear level hearing aid that has advanced tinnitus therapy options in it. That's almost always my recommendation, because even if they don't have hearing loss, that tool is going to give me the maximum amount of flexibility.
right.
And there are lots of available options that are not as expensive as people think, that when you have somebody with normal hearing, it's, they don't need all of the fancy hearing aid stuff in there, but they do need that tinnitus therapy. So luckily, I work with a variety of manufacturers, and I can find something that will have that customization in there. And so it's almost always that. Very, very rarely is it like a tabletop device, because you can't take that with you.
Right.
And our patients they're dealing with tinnitus all day long. And oftentimes their worst times are not at night in bed. It's they're living their life, So if they're going to make this investment, I want that to be, a long-term help to them. Right. So the one prong of this, I call it my trimodal approach, is sound therapy. The second one is behavior modification. I use cognitive behavioral therapy techniques just in my counseling, and we look at other behavior modification techniques as well for the patient, not necessarily cognitive in nature, but just in general, looking at their daily activities and, how can you modify your behavior to give you some improvement. And then the third one is stress management. And it's funny because you would think, do you really need someone to tell you to reduce your stress? Do I need to pay a doctor to tell me to do that? No, you don't need to pay a doctor to tell you to do that. But the reality is that many patients need to be held accountable for that self-care related to stress management. And if they don't have someone to hold them accountable, they're not really good at it. So if you're not managing your stress, then all of the other things that we're doing for your tinnitus are not going to be nearly as effective. So we focus on those three things from the beginning. Right. And the way we do that and the order in which we approach those different things is very much dependent on the patient. But that's how I approach it. And the conversation about CBD and or treating anxiety is early. It's usually the first session, because, that is very apparent when you look at their tinnitus history questionnaire, for example, and you're starting to talk to the patient, you're starting to see these relationships between, when their tinnitus is at its worst and these occurrences in their life that are causing them a lot of anxiety. So again, my goal is to help provide relief as quickly as possible for that patient. And we just need to deal with those things. So it's been a welcome change to be able to talk about CBD and, give that to the patient as an option.
Yes, I love it. I love that, there's things that we've always done. And then there's looking, outside of the box and figuring out, what are some other things that might work for some people. So CBD is one. There's other things that I don't know if you've heard of any of the tapping techniques at all, or.
I have heard of that. To be honest with you, I haven't had time to look at the research.
Right.
If there is any, to be honest with you, I don't know. But gosh, what a great tool if it is
self-generated, and it's just like tapping on your acupuncture points.
Sure.
And like you would say something like, even though I have this tinnitus, I totally and completely accept myself. And you just go through this process with it. And I haven't used it a lot in my tinnitus patients because I'm just kind of thinking, this trying to set all this up, I'm like, okay, what are all the alternative type things? And whether they work all the time for everybody or whether they work some of the time for some people and they're very low cost, what could be the problem with sharing that with people, because and I just found an app which I'm going to be posting about, that you can even go to this app and you can learn about it and use the app to do the tapping. So, with the CBD and the tapping and just other alternative type things that I'm learning about, that I'm going to have these resources on the website. And then somebody that's been somewhere that's been told there's nothing that you can do, you have to live with it, and they are in so much distress, they'll have just some resources of things they could try, because
Sure.
it's better than not having any help at all. So,
Absolutely.
and
Absolutely.
finding somebody like you, though, would be a really big benefit to them. So even if somebody doesn't live in your area, if they live in Florida, they could still get a hold of you and possibly have a telehealth consult to start with, correct? So then you could figure out what you need to do, and then they could possibly come over and, see you in person. But then you could do a lot of your other follow-ups through telehealth, correct?
Sure.
Yeah.
Yeah. So, I mean, honestly, so far my tinnitus practice has been people who can drive to me. So I think the farthest I've had a patient drive is like 2.5 hours. So, I have been able to see them at least once in the office to do diagnostic testing, but everything else that we do, especially with today's ear-worn devices, they are all remote care compatible. Okay.
Yes.
So because that is part of the management in different sessions, right? So sometimes we're changing up those therapy programs, we're changing the loudness, or we're changing the pitch, or we're changing the profile, or, and we're doing different things to help that patient find relief. But I will tell you that if I had a patient that was too far to drive, my initial recommendation after our first telehealth consult would be to collaborate with an audiologist near them so they could get the testing that they needed, a
Right.
proper workup. And then, once I have that information, then we can handle the rest of their treatment. So, I think there's really an opportunity in our field for us to do a better job of collaborating with each other. Um, you know, I do not do vestibular. Okay. So I don't do any vestibular in my practice. There's a huge need and it's such an important area of our practice, but that is not my specialty. So I refer people all the time to vestibular audiologists and I educate them as to what to expect, and with the full understanding that if they need tinnitus or oral rehabilitation hearing devices or whatever, that I'm going to get that patient back.
Right.
But I think with tinnitus, for whatever reason, we don't get that as much. I don't know how many referrals you get from other audiologists, but I don't get a lot of them. So I think some of it is people just maybe don't know.
Yeah.
We don't know about each other, right?
Yep.
So
And
like,
it's a
I
good
know
way.
you.
Right.
So I would definitely, if I knew someone on that coast, I would definitely send them to you because you're so involved in the field. But I think that we could do a better job of just telling ourselves, in our industry so that we can cross collaborate. But that's what I would do. I would send them to, an audiologist, who I know is going to do a proper evaluation, and then I could continue to work with that patient via telehealth. Absolutely. And you can actually go to my website.
Perfect. I was going to ask you that next. How do they get a hold of you?
Yeah, palmcoasthearingcenter.com. So it's Palm Coast
And I'll post that in
Hearing
the
Center.
comments too.
And you can make an appointment right on my website. There's a button that says, make an appointment, and you can select me as a provider and select a tinnitus, and it can be telehealth. Usually when somebody makes an appointment, we reach out to them within 24 hours to kind of give them the details of how all that's going to go. But so absolutely. And I actually really would love to be that first point of contact for patients, because even if it's not something I can do for them, at least I can help them find the help that they need.
Yes.
So I can tell them, okay, where do you live? Let me reach out to my network, and find someone. If you feel more comfortable seeing someone in person, I can help you find someone who's truly qualified, because I will say that unfortunately with tinnitus, there's a lot of misinformation out there and a lot of ways that a patient could get lost, you
Yes.
know?
Yes. So that's wonderful. And we're going to wrap it up for now, but I want to just say that, just having this, my whole goal for this is just so patients can find this. They'll know there's help different places, even if there's not someone in their area, like you were saying, they could get the test and you could say, I need this, and then they could come back to you and then you could walk them through this. Because we never want somebody to be told there's nothing that can be done.
That's
There's
right.
always something that can be done. So wonderful. So thank you very much for today.
Thank you.
If anyone has any questions, you can post below or send us a message, or you can contact Dr. Alvarez directly. And we may be doing some more of these. We may do a Facebook Live at some point, and you can ask her questions directly. But we
That would be so
appreciate you
much fun.
watching this today, and we hope you have a great day, and we hope we've helped you in some small way. Thank you.